Elpe, dietitian. Today I want to discuss with you the effect of a diet on IVF treatment. One of the main aspects of this topic is obesity, especially when the obesity starts at an early age. It can be a reason of infertility for both men and women, as it negatively affects women's ovaries as well as men's testicles. Especially women's body mass index, which is the result of dividing the weight in kilograms by the cubed value of the height in meters. When the index passes 30, it shows that the person is obese, and in this situation, the fertility is reduced by 3 times or even more. Especially women with a diet full of carbs with low physical activity should consider a diet change, because the fertility can be increased even by losing 5–10% of weight. For the men as well, eating too much fat and having too much fat percentage in the body of the male hormone estrogen will lead to low of pregnancy rate. Same way, losing weight will definitely help in reducing this for the mentioned reasons. The most important thing can be done is losing weight through a healthy diet. This healthy diet can be baked up with by sport. Besides that, one of the things that affects fertility is stress, and doing sports can reduce this stress as much as possible. One can try doing sport 5 days a week at least. The kind of sport you want is cardio-based. The World Health Organization recommends the cardio exercises should be supported by strength and resistance exercise twice a week. However, undergoing strength and resistance exercises, especially doing the mentioned exercises very frequently, can reduce the fertility. That's why one should stay away from exercising too much. In fact, as much as obesity affects infertility, being previously also affects us. Especially the women with BMI less than 90 have a deteriorating fertility for this type of woman. It is recommended that they have a healthy diet that targets weight increase. At the same time, losing 50% of the weight in a short period of time due to strict diet also affects the fertility. That's why one should stay away from unhealthy diets. At the same time, you can see high rates of obesity and sugar level of those who have PCOS disease. In this case, it's recommended to have a low glycemic diet or low carb diet with exercises that can affect PCOS. What kind of diets can be followed? One may ask. Actually, the best thing we can do is healthy diet. Most importantly is being active on a diet. While following this diet, 5–6 portions a day of fresh fruit and vegetables should be consumed, because some studies show that the antioxidants found in these fruit and vegetables help reducing the stress in the ovaries and improving men's sperm quality. However, it is still debatable. Regardless, in this type of diet, 5–6 portions of fruit and vegetables is provided. In the meantime, the diet should be rich in unsaturated fat, like the fat found in liquid oils such as olive oil and sunflower oil. On the other hand, one should stay away from trans fat. The trans fat is usually found in solid margarine. It might also be found in processed food. We also come across trans fat in fried food like fried potato and fried meat. One should stay away from all the aforementioned. It's preferred to consume as much as possible from legumes, with the green vegetables and fruits minimum 3–4 times a week should be in the list. In the meantime, red meat should be not consumed too much. This is the main point of Mediterranean diet. Once or twice a week, fish-based meals must take place instead. Eating fish 2–3 times a week should be enough. Again, the diet can be supported by dried nuts that are rich with oils like almond, hazelnut, and walnut, as these nuts are omega-3 source. Besides that, it will make a healthy diet for us. In addition, we don't want to include toxic elements to our diet. That's why we should be careful, especially for those who have kind of occupation and jobs that won't offer for these meta trails. In our diet, we should definitely be careful in crops and show more effort in washing the vegetables and fruits. Apart from that, coffee consumption should be limited to 2 cups of coffee a day. Alcohol also has a negative effect on fertility, as it can decrease the quality of sperms and ovaries. Also, it reduces the movement of the sperms. The negative effect is seen when drinking 5 to 8 glasses a week. However, some research suggests that even drinking 1 glass a day can reduce the quality up to 30%. For that reason, one should pay attention to coffee and alcohol consumption. We should be more careful about the food that we are consuming in terms of microorganisms, and that is a very important issue that research focuses on showing it. At the same time, some research shows that keeping microbiotas in a certain level to balance in the body is very good. That's why we should increase consuming probiotic food. The best example of this is consuming probiotic-made yogurt or kefir. At the same time, consuming fermented food, for example pickles and tarhana, as well as consuming vineyard. But the most important part is enhancing microbiota with macrobiotic food. At the same time, it's important to talk about the necessity of having vitamin D, which we can find in the best source of it in the sun. Every day walking on the sunshine time for 15-30 minutes is going to be useful for us. Otherwise, you can get an extra vitamin D help from the doctors depending on the blood test result that you make.